1 FM, AM 1160, and WCCSradio.com. And good morning to you. Glad that you are with us on this Friday morning and a chance for us to meet another of the physicians from IRMC and the IRMC Physician Group. I assume it's Physician Group, is it?
Correct.
Oh, good. Dr. Yvonne Chan is with us this morning, and our conversation is brought to you by Marcus & Mack, voted best personal injury law firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. So where do you practice? With which practice are you affiliated?
I practice with IPG Pulmonology. That's the Indiana Physicians Group. Our location is at the 119 Professional Center on Wayne Avenue. I also have a location at Punxsutawney Hospital.
Oh, okay. So you're well traveled.
Yes.
that lovely road to 119 North, huh?
It can be treacherous sometimes, but for the most part, it's really a beautiful drive.
Yeah. How often are you there?
I'm there every other week on Mondays and Tuesdays in Punxsy, and then I'm at Indiana for the rest of the month.
Yeah. For folks who don't know what a pulmonologist does and where your area of concern is, let's just open that box a little bit because it might be a mysterious term to folks. What is a pulmonologist?
In layman's terms, I am a lung doctor, so I treat diseases that involve the lungs, any breathing issues that patients might have. Some of the lung diseases that you may know about are asthma, COPD, cystic fibrosis, lung cancer, pulmonary fibrosis. There are a lot of other lung diseases that are more rare, but anybody who has any kind of breathing issues or trouble with cough, they would come to me.
It's it's a great area to be involved in. I'm sure as a physician, you get to see so many different conditions. I don't know if it's like a baseball player. If I can hit the curve, I can hit the fastball, I can hit them all. But with pulmonology in particular, and with the prevalence of smoking in our area, I would assume that you get a lot of work that involves looking at folks who have been smoking for a long time and they've got the conditions to prove it.
Absolutely. We are a very, very busy practice. There's a lot of demand for our services. Smoking is a big issue. The other thing that I've noticed is that we have a lot of coal mines around here that are still active. There are many patients that have occupational exposures to the coal dust or the rock drilling. Closer to the Pittsburgh side, you have people who have worked in steel mills, and there was a lot of asbestos exposure associated with working in steel mills. So there's a panoply of lung diseases that are associated with a lot of the industries in the area.
All right, let's talk first about smoking and the effects that it has on the lungs. So we hear the studies, we read the studies. We can't understand how anybody born after 1960 would ever put a cigarette in his or her mouth, but people do. And it's a very common thing, and the effects of it can be absolutely devastating.
You're absolutely right. Smoking is associated with particularly COPD. Secondhand smoke exposure can sometimes be associated with asthma or asthma exacerbations, and everyone knows that there is the link between smoking and lung cancer.
Yeah. Screening for lung cancer, I'm sure it's recommended, especially for smokers. Should everybody be screened for lung cancer at some point?
No, I'm glad you asked that. There was actually a study that was published in the New England Journal in 2011. It was called the National Lung Screening Trial, where they looked at patients of a certain age that had smoked for a certain number of years and screened them based on CT scan versus chest x-ray. And they actually discovered that patients that received a CT scan, it's something called a low-dose CT scan. So that's a CT scan that is using a lower dose of radiation than a typical CT scan would use. Those patients had a 20% improvement in survival because their lung cancers were caught sooner. Now, the age groups that should be screened, the USPSTF recently revised the guidelines in 2021 to people between the ages of 50 and 80 with a smoking history that is greater than or equal to 20 pack years. And the way we calculate pack years is the average number of packs you smoke per day multiplied by the number of years you've smoked.
Okay.
And if you are either actively smoking or have quit within the last 15 years, those patients should be screened with a low-dose CT.
We hear quite often about the reversals in lung maladies when you quit smoking, and how quickly doctors such as yourself will notice improvements in someone's lung functionality. Is that really true? When you stop smoking, is the turnaround that quick? Not that you get full recovery from the effects of smoking, but that you improve right away?
Well, of course, absolutely. You're removing a toxin that you are poisoning your body with every single day. Now, some people complain about the weight gain, and there are some lifestyle modifications we can recommend to mitigate that. But, absolutely, you can experience improvements in cough and shortness of breath when you quit smoking.
Yeah. Smoke Free for Life is one of the programs offered at IRMC that is really, really effective. And I think people are so impressed by the way that program works. It really is a solidly built program, isn't it?
Absolutely. And I would have to credit my colleague, Dr. Rohit Mehta, on being instrumental in getting this program off the ground at Indiana Regional Medical Center.
The Smoke Free for Life classes, I think the next one begins in April. I think they had one start in January. They've got one coming up in April. So if folks are interested, they can get in touch with IRMC and they can make sure that they are in line for that. There are tons and tons of smoking cessation methods. There's hypnotism. There are the very different items that folks can do, and we highly recommend them. When you see patients at IRMC, I know frequently it's going to be upstairs in the ICU because their conditions are that advanced. But you're also in an office setting, and that's an entirely different atmosphere, isn't it? And a different way to work with patients.
It is, and this is a new thing for me. I recently set up office hours in December of 2023. I originally came to Indiana Regional Medical Center in 2019 to work in their ICU. Before that, I was actually a hospitalist, and that is a physician that stands in place of your primary care physician in the hospital if your primary care physician doesn't come to the hospital. So I've worked in various jobs as an intensivist, which is a type of hospitalist that sees patients in the ICU. Those are the most critically ill, sickest patients in the hospital that need extra monitoring. And I worked there for a couple of years, took us through the COVID pandemic. And I have to say that I really am proud to have worked with some of the bravest, most valiant staff members in this area. I want to really thank the respiratory therapists, the nurses' assistants, the secretaries, the housekeepers who all braved illness and put themselves in danger to work through that pandemic.
Yeah.
And I have to credit them with convincing me to set up office hours, because as you can imagine, during that time, it was very difficult to get doctor's appointments. Mm-hmm. And so some of the staff would approach me to look at their x-rays or discuss an ailment that they might be having or to talk about a family member. And they really kind of told me, hey, you need to set up a clinic. You would have so many people come and see you.
Yeah.
The other thing that really convinced me to have a clinic is patients. I would see patients with lung diseases on the floors in the hospital, and they expressed disappointment when they found out I didn't have a clinic for them to come and follow up with me. So I felt like this was a service that the community needed.
Yeah. I hope that this is something that really sticks because your service is so vital. With the pandemic, so much of what we were hearing had to do with breathability and how difficult that was, and how that was one of the most challenging, if not the most challenging aspect of the COVID-19. For you, I'm sure that there was a really high necessity to step up your game in terms of your education of yourself about what was happening and how to go through the treatment protocols, all the information flying at you. That must have been a crazy time.
Absolutely. It was very challenging in terms of intellectual strain and emotional strain. We lost a few people in the ICU to illness. So there was a lot of human resources strain. It was historic.
Yeah, yeah. We only have a little bit of time left. I feel like I could go on for hours with you. I wanted to talk about one condition that you mentioned that is also very, very common, and that is asthma. In this area, I don't know that it's any different. Asthma seems to be everywhere. The pollens in the air, the various things that will affect somebody who has an asthmatic condition. Is it more prevalent now than it's ever been? It just seems, or does it just seem that way?
I think in some respects we're recognizing it better. But yes, there is a lot of particulate matter up in the air, and that can drive asthmatic progression.
Mm-hmm.
I'm not sure if it's more prevalent or if we're recognizing it more. I think time will tell.
Yeah. In terms of treating asthma, young children can have it, older folks can have it. It's up and down the whole spectrum of people. And I would assume that the treatments are different depending upon the age and the various conditions that folks have too. Am I right about that?
I think you would probably avoid using systemic steroids more in children. Full disclosure, I'm an internal medicine physician, so I don't actually see children.
Mm-hmm.
So I can't really comment specifically about children.
Yeah. Asthma as a whole, though, is a very difficult condition for folks, and they have to be on the constant watch, don't they?
Absolutely. And there is no guarantee that someone who is labeled as having mild intermittent asthma couldn't exacerbate suddenly and have a life-threatening situation. Mm-hmm. So it's very important that people who have an asthma action plan.
Yeah, especially since now we're getting the air quality alert days that become so common in the summertime.
That is a little fearful, actually, with all of the forest fires carrying and the winds carrying a lot of the particulate matter from the fallout.
Like I said, we could go on for hours with you. We're talking to Dr. Yvonne Chan with IRMC Pulmonology, and we're learning about a number of different things. You have in front of you some notes that you prepared. Is there something on there that you think folks really need to know?
I just want to remind folks that IRMC does offer the Smoke Free for Life tobacco cessation program, and indeed the next class begins in April. You can learn more at irmc.org/lungs, and anyone can make an appointment with the pulmonologist. You don't need a referral, and our number is 724-357-7075. People
might say, I'm not feeling any symptoms yet. I don't have to really worry about anything like that until I start coughing too much or I find it difficult to breathe. But that's not necessarily the case.
Well, especially if we're talking about lung cancer, right? If you are one of these individuals that fit the lung cancer screening guidelines, unfortunately, cancer can be asymptomatic. Mm. There aren't any typical symptoms that indicate that you have lung cancer, and if you are having symptoms, they might actually be symptoms of late disease. Mm-hmm. So it's vitally important if you fit the criteria, and again, that's ages 50 to 80, with greater than 20 pack years of smoking history, and if you are currently a smoker or have quit smoking within the past 15 years, you would warrant a low-dose CT scan. So
some guy out there just dropped his pencil because he rushed to get it to write down that number you gave. Could you give it one more time?
Sure. It's 724-357-7075.
Dr. Yvonne Chan, so good to meet you, and so good to know that you're doing something that hasn't been done before around these parts, actual clinic hours in your own office.
Oh, I want to actually correct that. There have been two other pulmonologists, Dr. Rohit Mehta and Dr. Imran Bajwa, whose clinics are actually extremely busy, so I'm actually helping to alleviate some of that strain.
Nice. Good to meet you. It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com.